Hello everyone, Dr. Ashish Khare, consultant plastic surgeon, discussing about a double incision mastectomy, which is a surgical procedure where both breasts are removed to get a more flatter chest and a more masculine appearance to the chest wall. This involves making two horizontal incisions around the bottom of each breast to excise the excess tissues. The procedure also includes resizing and relocating the nipples and the areolas to the new position on the chest wall. The goal of the double incision mastectomy is to remove the breast tissue and to create a flatter chest and to reshape the nipple and the areola complex. Well, in this, we place two horizontal incisions which are usually along the base of the chest muscle. The excess breast tissue, the excess skin and the fat is removed and then the defect is closed. The nipple areola are typically removed, resized and repositioned to the new location on the chest wall. The procedure leaves two horizontal scars along the inframammary crease which may fade after some time, maybe around 6 weeks to 2 months. Recovery may be 8 to 10 days and may involve initial drains followed by bandages and some changes in the nipple sensation. For more queries regarding double incision mastectomy, female to male procedures, you may connect with us at Kalosa Aesthetics. Thank you.